So one question that we received is there evidence that it looks like turmeric curcumin can help ease arthritis pain? And if so, what dosage? So I'm thinking that's probably like a natural supplement.
Yeah, yeah. So turmeric, I know very well because it's actually in a lot of Indian food. Turmeric does have some anti-inflammatory properties. There was this recent study not too long ago, a few years ago, that did show that it does have some anti-inflammatory properties in it. So that is something that people have asked me about, and I do recommend it. The general dosing is 500 milligrams for twice a day.
Mhm.
That is something also we have to be careful with while on blood thinners as well. So that's something to talk with the provider if you are on blood thinners. And as most people know, if you're on blood thinners, there's a lot of interactions. Just add this to the list.
Yeah, yeah. Okay. Are there any other kind of natural type,
So there,
vitamin supplements that
yeah,
help?
yeah. So there is some thought behind glucosamine sulfate. Now, the key component is sulfate. So there is kind of the studies are iffy a little bit. They showed about 50 to 60% effective. The dosing on that is 1,500 milligrams twice a day. That is something that uh, generally you do have to take for a solid month to show to see if it is effective. And a lot of times, some patients will say, I've been taking it for a month, and I do notice a little difference, when I take it and I don't take it.
Mhm.
And again, that might be a small part of the whole treatment plan. And I think that's something important, that it's not always just one thing or the other.
Mhm.
A lot of it is, I always like saying it is a buffet style. It is what we can grab and what works for each patient.